afternoon and welcome to our South Pod podcast. You're all very welcome. My name is Marita McGuinness. I'm Assistant Director for Social Work and Social Care Governance, and I'll let my colleagues introduce themselves.
Hayley Smith, Service User Representative.
Kathy Diffin, Social Worker and Integrated Care Team in Portadown.
I'm Martina McAloon, MDT Social Work Lead.
So we've come together this afternoon to speak about the World Social Work Day 2026. And the theme this year is Co-Building Hope and Harmony, a Harambee Call to Unite a Divided Society. So that's an interesting concept, isn't it? I have to admit, I had to look up to see what a Harambee was. So Harambee is a Swahili term meaning pulling together, and it's very much linked with a Kenyan tradition of communities coming together in a self-help approach. I suppose when I was thinking about today, I was reflecting on the whole idea of hope and how important it is. And I suppose I love the idea of thinking about co-building hope and harmony. And hope in itself is so important in terms of being the fuel to help us to deal with and respond to the challenges that we face sort of on an everyday basis. And I suppose my sense is that it really connects us as people and communities in terms of building support and trust and as a way of going forward. So Martina, in your role in leading social work in the GP practices, what does hope look like in that context in terms of the communities and the people that you serve?
Yeah, I think hope's more than a word. I do think it is a feeling and an emotion. I think for the social workers, for the team, they need hope, they need a shared vision, they need to understand their patients and what's going on out in the community. And I think for the patients themselves, they need hope, because the majority of times that they come to see us as social workers, they're generally in crisis, and there's a lot of words and emotions around them, like despair and remember anger or frustration. And the best thing to do is throw in that word hope, because it gives you positivity, and it means that maybe tomorrow can be a wee bit better than today.
Yeah, absolutely. And I suppose how do you see hope helping us in responding to some of the challenging situations that you would find yourselves in with your service users?
I think it gives you that positivity, that you believe that everyone has the capabilities of change, and sometimes they need a helping hand. I think it's solution focused. It's not about looking at the negativity all the time. It is about being positive. It is about seeing the future, being happy, being content, improving your well-being and looking towards that. And I think everyone has the potential for that.
Absolutely. It really is so important in terms of that bit about moving forward, isn't it, really? I'm thinking, Hayley, from your perspective as a service user, what gives you hope?
Oh, crikey.
Mm-hmm.
I had a major surgery back in August of 2024, and that was a major change in my entire life. Everything changed. And so it would have been very easy to give up or not to try, but I've had a wonderful team, a social worker, social work assistant, social care staff, have all been fantastic, helping me maintain whatever independence I can, but then removing those techniques, those things that I can't, and doing them to help me doing them with me. I built up some really good relationships with some of the team, Lisa, Grace, Joanne, wonderful girls, Helena, there's so many of them, Mandy, there's loads of them, I couldn't get through them all, but they know who they are, and I'm really, really thankful that they're come in and they help me. My social worker Kira Rocks and social work assistant Kathleen McMullen, I think her surname is. Brilliant. Made those onward referrals, got me out of the house, got me working towards regaining some sort of sense of fitness and health, and so that gives me a lot of hope. I mean, I still think it's still early days for me, but they've basically carried me through those really difficult months. So I want to thank them. They know who they are.
Thank you for sharing that, Hayley. So heartening to hear that, isn't it? And a real reminder to us as a profession that actually the importance of those relationships in our everyday work.
Yeah.
So that's just lovely to hear that. And can you tell me a wee bit more, what is so important about the relationship?
There's a handful of them that take a lot of time over and above their allotted time. I'm sure they get into trouble for it, but I don't think they care very much. They take that time so that they get to know me. We've built up that really good relationship. You know, there's professional boundaries, of course, but I mean, it's just that nice. That I know when they're coming in, I'll get a good wee chat, and if I'm annoyed about something, we'll just sit and listen. But it's just, they're so sweet small gestures, but they make a massive difference. And I don't think they realise how good they are.
Wow, isn't that lovely? And it takes us back really to the essence of relationships, in terms of that wee bit about going that extra mile and the difference that that can make to you in your day-to-day experience. So important. So thank you for sharing that, Hayley. That's so lovely to hear. And Kathy, I'm thinking in your role, so you're in the multidisciplinary integrated care teams, and I suppose I can only imagine that hope plays such an important part in the work that you do with adults who are in the latter stages of their life. Not that they're necessarily at the end stages of life, but you know, they're in their final stages. So tell us a wee bit about what that looks like in your world.
Yeah, well, it's humbling, I suppose, getting to go out and visit people in their point of need. I come into social work to help people help themselves, so it's really important to make sure to look at the bigger picture. So you're going out making sure, as Hayley says, the importance of building relationships. So not just reading somebody's information from their file, but actually getting out and getting to see what's important to them, what's important in their lives, what strengths they have, what needs they have, and looking at what supports they can have from family, because obviously ultimately that's what they want, and then after that they're looking at the community side of things. But I suppose just making sure that people have the supports in place that they need, and making sure it's person-centred and focused on what they want, and everybody working together. As you said, I work in an integrated care team which has district nurses, physios, OTs, and it's everybody working for the best of the person in as timely a manner as we can possibly can.
Yeah, I love that idea of that's real co-building in action, isn't it? Tell us a wee bit about what that looks like in the multidisciplinary team, so working with your colleagues in terms of co-building and creating hope for the people you serve.
Yeah, so it could be somebody going through a crisis, for instance, and that might be where district nurses bring it to our attention, or vice versa. And it's everybody sitting down and working out a plan as to how to best meet that person's needs there and then. It could be that we need a district nurse to go out to do urgent bloods. Maybe somebody's confused in the home and they're struggling. But it's again about everybody working together to best meet that person's needs as quickly as possible as well, to make sure that they're not in a state of crisis. And the same with even trying to support family members. It could be district nurses coming forward with that as well. If families are struggling, if there's respite required, the simple things. It's just making sure that we're all working for the best of that person that we're working for and working with.
Yeah, and I suppose that's making me think the importance of that sort of multidisciplinary working. And Martina, I'm conscious in your world, that's at the heart of your world, working out in the GP practices. What does that look like in your teams when you're working with the GPs?
Yeah, I think we enter the medical world and they weren't maybe ready for us. You know, we're non-clinical. We go in and we talk about things like poverty and transport and relationships and connections and isolation and loneliness and things like that. And GPs were getting an awful lot of appointments like that. So the beauty is now that you have a social worker, you know, that doesn't think medical and is thinking of all that community. I think, you know, we're working with every age group, and from the day now we're born, everyone needs connectivity. They need to feel connected, and the most important people to feel connected to are your family and your friends and your community. So to do that, you need to go out into the community and build relationships. You need to have the knowledge of what's in the community, you know, what resources are available for people, and, you know, co-building, co-designing, you know, co-production, all big words for just making relationships. And how do you make life better for this patient? You know, with the amount of organisations out there is absolutely mind-blowing. I think no professional has a magic wand, you know, and the community knows the community, they know each other better and feel comfortable in that environment. So it is about connecting people. So for us, it's about building relationships with all those organisations and getting out and about, not being clinical.
Absolutely. And isn't it so heartening to see the role that social work and the contribution that social work can bring to that multidisciplinary context in terms of really making those connections out into the communities, which is exactly what you're describing there. I think what we're really, there's the recurrent theme there about the importance of the relationships, both at a one-to-one level and right through then out into our communities. And I think you're absolutely right. Social work has a really positive contribution to make to that and on all those levels. And that whole sense of working together and pulling together, that Harambee, is a real natural way to build hope, isn't it? And I'm conscious we've recently re-established our local engagement partnership, which is a group of service users and staff, social work staff, who have come together to look at how we can strengthen, support and improve our social work service, both from a staff perspective and from a service user perspective. So it's a really valuable golden opportunity, I think, for us to pull together and see how we can make improvements. And I know you're all involved in that, and Hayley, you've had a lead role from the service user perspective, which is right at the heart of what the local engagement partnership is all about. So I'm thinking, Hayley, why is being part of the local engagement partnership important to you?
And because of my own experience, especially when I heard it was being stood back up again and the expressions of interest went out, I went, yeah, that suits me, that's perfect for me. And I think with the LEP, they recognise my skills, and that I've really felt integrated on an equal partnership level from the very start. So from the very first meeting, I found that, yeah, my views were sought straight away. Recognise the skills, especially if there are other service users representatives on the panel there, and actually utilising those skills, which sometimes can be frustrating if you have a certain skill but you can't use it. So it's nice to see that, and it's really to see. Maybe not everybody has had as really good at experience as me, so I would like to work with the staff to maybe so that those numbers are down to zero basically, and I think we'll work really well together, and I think we're all pushing the same direction as well. So it's really positive.
Yeah, it's a really exciting opportunity, isn't it? And I love that piece of you giving back into, you've had a really positive experience, and your encouragement to our workforce to really understand what makes the really positive experience is key to that, isn't it?
Yeah.
No, so that's really important. And Kathy, I'm thinking for the when we look at the social work workforce and the challenges, sometimes we kind of tend to focus on the challenges, don't we, because they're very present and we experience them on a daily basis, but really important for us to maintain a focus on hope as a workforce. And so what gives you hope for social work workforce going forward?
Suppose we have a lot of students that come and go through integrated care team, and it's about the importance too of, she's our student at the minute's coming to the next LEP meeting, and it's about making sure that she's working with other service users, but also working out in the community groups as well and seeing what services there are out there. We would have a lot of service users waiting on the likes of trust day centre placements and things like that, and the waiting lists are quite long, but while the waiting lists are quite long, our service users are in the house and waiting for somewhere to go, so it's about trying to connect them back to their communities as well. So the student that we have at the moment is actually out working with a community group to try and look about another day that they could maybe run for service users out in the community as well. So I suppose it's thinking outside of the box and just trying to work in different ways to make sure that service users get their needs met, and it doesn't necessarily have to be through trust resources, it could be through the communities as well.
Yeah, absolutely. And I love that idea of the students and the role, that the really valuable role that they play in coming in to our services, and the hope that they bring, because they're fresh, aren't they? And we soak off that, don't we? Yeah. Martina, would you have students in your service?
Yes, we have 4 students at the moment, and we have 2 social work assistants that have went on to do the OU, so they're social work assistant students with ourselves at the minute. So it was a brilliant opportunity for them to get on the course and then make it amazing social workers.
Yeah, great. Yeah, no, that's so exciting. And I suppose it's so important that we we feed ourselves with the encouragement to be hopeful going forward, and that comes from our students. I think the local engagement partnership has a massive role to play there, because it's a massive endorsement of our workforce and the work that social work does, and also then just that insight from a service user perspective is so invaluable. Okay, well, thank you so much. I think that brings us to a natural close for our discussion today. My invitation to those who are hopefully listening to our podcast is that they take some time over the next week or the month. I think we're going to claim the month of March for Social Work Month, and invite teams to take some time to reflect on the work that they do, to think about hope and how they instill hope in their service, in the team that they work in, and also for their service users. And we look forward to hearing some of the feedback from that. Thank you. Thanks so much.
Thank you very much.
Thanks.